So thank you very much for coming today. I'm very happy to be here with you. This is the first talk on pregnancy, which is the very beginning of life. So I hope to enjoy it. I think most of you know that there is consensus among nutritionists, dietitians, about the safety and adequacy of a vegan diet during pregnancy and breastfeeding. This is the statement, the latest statement from the British Association a couple of years ago, saying that. We have other societies, like for example, like the American Academy of Nutrition. They have been saying the same for the last at least 20 years. This is the latest statement a couple of years ago also. And they say the same is safe and adequate for all stages of life, including pregnancy and breastfeeding. And another example, for example, this is from the Canadian Association. So there is clear consensus about this, but this is the theory. When we go to real life, what we see, what we find sometimes is this situation. I don't know any celebrities personally, I mean, but as a vegan pediatrician, I have been in contact, I have been counseling many vegan families for the last few years, and I find this situation to be very common, very frequent. So normal, healthy vegan women who, when they get pregnant, they are under a lot of pressure by their health professionals, family, friends, to stop their vegan diet over concerns about their health and about concerns about the baby's health, which they are not justified, but, and for some of them, for some of these women, it's a very difficult time of their lives, and this shouldn't be this way because there is no reason. So what we are going to see this morning, for the next half an hour, we are going to review very briefly what are the studies on vegan pregnant women are showing us. We are going to see what is the normal requirements in pregnancy, during pregnancy, and how we can meet them with a plant-based diet. And based on that, we are going to see which is the best advice we can give to our vegan mothers to be. So, from the point of view of studies, we know that nutrition is quite important for the outcome of the pregnancy. Along with other factors, nutrition is probably one of the main factors, not only affecting the outcome of the pregnancy, but also the health of the baby and then the child. We know, for example, that both undernutrition and overnutrition, eating too little or too much, can lead to gestational diabetes. And gestational diabetes is not only a complication of pregnancy, a very common one and potentially a severe one, but we also know that women who experience gestational diabetes are at higher risk later in life to experience diabetes. And we also know that their children, when they are born and then when they are growing up, they are also at higher risk. So this is very important because by intervening here, by trying to prevent this complication of pregnancy, we may have a higher impact in the lives of the mother and the child. And it's not only eating too little or too much. Not eating the right foods can also lead to problems. And there are many studies showing, and that you have a good review here if you want more details. There are plenty of studies now showing that diets that are low in plant foods are associated with adverse outcomes in both mothers and their children. So this is what we know about nutrition in general and about plant-based nutrition. So this is probably the first and the oldest study in a community of vegans from the US. They were living in Tennessee, and most of them were vegans. There were some vegetarians as well. And when the researchers looked at their clinical records of these women during their pregnancies, they were shocked to see that they could only find a case of preeclampsia among the more than 700 of them. And because preeclampsia is very common during pregnancy and can be quite severe, this was a surprising finding, and they were really shocked by that. Also, they studied the length of the pregnancy on these women and the birth weight of their babies, and they compared that with the general population in the US at that time, and they couldn't find any significant differences. So they concluded that a vegan diet could be safe during pregnancy. I have to say that this community of vegans, they were very health conscious. They were using supplements during pregnancy. They were using also fortified soya milk and nutritional yeast. And they were based, their diet was based on whole foods with minimal or no processed food at all. Since then, in this study, there have been some more, not many, I have to say, not many. And one of the problems is that they tend to put analyze together vegetarian and vegan women. And we know now that it's not the same, but this is what we have. And this is a recent review of all the studies done in the last 20 years. And if you want more details, you can read them here. But the main findings is that from all the studies, they couldn't see, these researchers, they couldn't see any adverse effect of a vegan diet on the outcome of the mother, the pregnancy, or the child. So they couldn't see a higher incidence of complications in pregnancy, birth defects, or any other problem. And overall, the birth weight of the babies and the duration of the pregnancy was comparable with the non-vegetarian population. So they concluded as well that a vegan diet during pregnancy, as long as it's supplemented with vitamin B12, can be completely safe and have a normal outcome. Okay, so we are going to see now, to look briefly again, because we don't have much time, to the main nutrients that, and the requirements of these nutrients and how they change over the time of pregnancy and during breastfeeding. And we are going to focus on this because they are the most, probably the most critical ones or the most important for the outcome of the pregnancy. So we know that protein requirements are increased during pregnancy, especially during the third trimester when the baby is growing fastest. And you can see here how they increased. And I have put here just for you to have a practical idea of how this increasing translates into normal servings of vegan foods. And for example, if you take all these 8 foods together, they provide most of the needs for a vegan woman during the third trimester when the needs are the highest. Of course, you don't have to eat everything of this. You can different equivalents, but the message here, if you have 3 servings of legumes or beans or that group, and 2 of nuts and seeds, you are going to cover at least 2/3 of your needs. And the rest of the protein requirements can be covered with the other normal foods like grains and veggies and fruit and whatever. So these 2 groups are important, legumes and beans, and nuts and seeds, in providing good quality protein. And they don't provide only protein, but also important minerals and vitamins as well, as we are going to see later. Iron is another important nutrient, and the requirements are increased during pregnancy, especially during the second and the third. And most people think that it's really difficult to get these amounts from any diet, any kind of diet alone. But supplements, the NHS doesn't recommend supplements for all women, just to try to check how they are, the iron reserves are, and offer them to women who have low iron stores. And it's important to know that absorption can increase, and some studies have shown that can increase up to 60%, which is really important, because even if the needs are very high, with some women with the appropriate nutrition can get enough. But it's important also to know that most women at some point, vegan or not vegan, are going to need some iron supplements, and it's okay to provide them with that. About iron from plant foods, we have to remember that we can influence the absorption, and the absorption is not the same, can be quite different. And the main factor that affects the iron absorption is vitamin C, Vitamin C, the messages. So, and that translates into having plenty of fruit and vegetables during each meal. This is the best way to make sure that we are absorbing as much iron as possible from our plant foods. We know that phytates coming from legumes and whole grains can interfere with iron because they bind together and it's more difficult to absorb them. But using techniques like soaking and fermentation, we can reduce the amount of phytates, and that is going to increase the absorption of iron from our diet. Calcium is another important nutrient. The requirements that do not change during pregnancy, but I would like to focus a little on this one because it has a potential role in preventing preeclampsia, and preeclampsia is a very it's a common and potentially severe complication of pregnancy. And this systematic review shown that from multiple studies on populations with low calcium intake, when they get supplemented with calcium, they could reduce the frequency, the prevalence of preeclampsia. So calcium is important, and it's possible and not difficult to get enough calcium from a vegan diet, but it's important to choose the right foods and to include them in our daily diet. There are two main groups of calcium-rich food. One is the green veggies that are high in calcium but are low in oxalates, because remember that oxalates can bind to calcium and make their absorption more difficult. So here you have some examples of them and how much calcium they provide. And the other group is food like fortified plant drinks. Can be a very good source of calcium, and it's calcium that is easily absorbed. And also tofu, soya beans, other beans, and nuts and seeds are the other good source of calcium. The absorption is different according to the group, and as I just said before, this is the best group in terms of absorption. Almost to 65% of the calcium can be absorbed. Be careful because we can't mix this group with these other green veggies, spinach and sweet chard and other similar ones that taste more sweet, are very high in oxalates, so the absorption of calcium is poor. And then in intermediate levels you have this one. So it's good to have at least part of this every day, and then some of this the other group. This is iodine, and this is, I call it like the neglected nutrient in nutrition, because very few people remember or think about iodine, and iodine can be a problem. And can be a problem in this country because we don't have good sources of iodine. It's not only for vegans, but vegans can be more affected if we don't pay attention for this. So we know that iodine is essential, is vital for brain development of the baby, and iodine deficiency is probably the commonest cause of intellectual disability in the world, preventable, and growth retardation in babies all over the world. And for the last decades, the best strategy we found was to add iodine to the salt of these populations, and we have decreased the prevalence of iodine deficiency in these populations. But in the UK, salt does not have added iodine. Also, the soil here, not only here but in all Europe, is very poor in iodine, which means that all the food we grow here and we import from the rest of Europe is not going to provide much iodine. And that is why, especially vegans in this country may be at higher risk of iodine deficiency. And this is because the main sources for the general population are salt in the countries where salt is fortified, not in this country. This is only a problem now can be a problem because many people are trying to reduce the salt intake, which is good So I think we should try to look for other food to fortify in the near future, because it's not going to be a very reliable food now. The second one is dairy products, not because dairy products are naturally rich in iodine, but because cow's food is fortified with iodine. So their milk is rich in iodine because of that reason. So that is the main source for the general population in this country. And then, of course, food coming from the sea, because the sea, the oceans, are the best source of iodine. Iodine comes from them. So if you see this, like fish is a source for some people, you maybe wonder, what about seaweeds? Because they also come from the sea. Are they a good source of iodine? And the answer is yes, they can be. The problem is they can have too much, they can provide too much iodine. And this is important because too much iodine can be as bad as having too little, especially during pregnancy, because there are some case reports reporting that women who are taking very high intakes of iodine during pregnancy, that can suppress the thyroid gland of the baby, of the fetus, and then the baby. And when the baby is born, they can go into trouble. So it's important to take this into account, that they can be a good source, but we have to choose which ones and the frequency if we want to take them as a source of iodine. So here, from this analysis of seaweeds and other foods in this country, in the UK, this is the average content of iodine in the most common seaweeds here, and this is the percentage of daily requirements. So you can see that this is a big difference. So I have classified them in 4 groups, and there are these three groups that people could take them regularly, like up to 2 or 3 times a week, because they can be a valuable source of iodine. But you have to be careful with these 3, because they can provide too much. This is for the general population as well, not only for pregnant women, but for pregnant women specifically, because they are at higher risk of having problems with this and their babies. So based on this, my recommendation, what I tell to mothers during pregnancy, is if we have this group of, if a woman is not taking, that is not including seaweeds in their diet, and she doesn't like them, it's okay. So the idea is for her to have an iodine supplement, if she was not taking it before, but to start at least as soon as possible with one. For women who are taking them regularly, if they are taking like the right amount, and we can check that either measuring the urinary levels can be a good, or with the thyroid function, and also asking them how many are taking a week and calculating the amounts. If everything is okay, she can continue doing the same. But if not, if she's taking too little, it will be good to add a supplement. Or if she's taking too much, it's important to tell her to reduce or to stop the intake of that, because that can be dangerous. Okay, another important nutrient is vitamin A, especially during breastfeeding, because human milk is very rich in vitamin A. It's essential for the baby, not only for the visual system development, but also for the immune system and for the general growth of all tissues. And we know that the levels in breast milk are in relation with maternal blood levels and with intake. And I'm sure you know that we cannot find vitamin A in plant foods, but we can find the precursors, carotenoids. And there are quite a lot veggies rich in vitamin A. These are, for me, the 3 queens. I call them the 3 queens because any of them can provide almost half of the needs during the breastfeeding, and only one of these for us will cover all our needs. So these are very important. All veggies that are very bright colors like orange or red are very good sources, and also some veggies also provide good amounts. So it shouldn't be difficult to reach our requirements, but it's important to plan the diet, so we are including this on a daily basis. And it's good to start during pregnancy, so we have good stores when we are going to start breastfeeding. And the last nutrient I wanted to just to make some comment is zinc, because plays a very similar role to vitamin A during pregnancy and breastfeeding. It's important for the baby's growth in general and also for the immune system. So and the thing with this nutrient, with zinc, is that there is not just one food that provides a lot of it. So we have to have a variety of foods during the day and during the week. The main source compared to serving sizes are nuts and seeds, are very good. So that's one of the reasons to include at least 1 or 2 servings a day, not only because of the protein content, but also because of the mineral content, and then the rest of the thing we can take. So if you see the amounts per serving are very similar, so we need at least 5 to 6 foods rich in this mineral to reach the total requirements we need. There are a few things we have to take into account about this one. Similarly to iron, zinc can be, the absorption can be made more difficult with phytates, but similarly to iron as well, usual techniques in cooking, like soaking and fermentation of bread, for example, can improve zinc absorption. And also another tip I would like to tell you is that nutritional yeast can be a very good source of zinc, and many brands are fortifying with more. And for women that you suspect cannot reach because they eat little amounts or for other reasons, can be a very good addition to milk. Just 1 tablespoon a day can just help them to reach the requirements. Okay, so apart from these nutrients that can be reached, can be covered with a well-planned diet, I would like to comment about some supplements. They are not exclusively for vegan women. Most of them, I think all of them, are also applicable to the general population. For example, folic acid, as I'm sure you know, the universal recommendation is to take supplements before, at least 12 weeks before conception, if possible, because when you supplement with folic acid, the incidence, the prevalence of birth defects has decreased significantly in the past decades, so that the changes has been really important. So even if vegans usually take more folic acid because there are no studies specifically on the vegan population, the recommendation is the same, these 400 micrograms a day, at least during the first trimester and in some cases even later. So this is for everyone, not only vegans, for everyone. Vitamin B12, of course, we also know that all vegans must be having supplements even long before getting pregnant, either from supplements or from fortified foods, as long as they are taking them enough, at least 2 or 3 times a day. I don't think fortified foods are enough to provide enough vitamin B12 during pregnancy and breastfeeding, because the needs, the requirements are very high. And we don't know exactly what amounts we need, because there is not consensus about that, and because there are some ongoing studies now at the moment, because what recent studies have found is that a vitamin B deficiency or suboptimal status is very common in the general population and in vegetarians and vegans as well. So it's very common to find, and during breastfeeding, because the levels are decreasing with breastfeeding. So we don't know how much we really need, and probably more than the general requirements, the recommendations were before a few years ago. We know that vitamin B12 is essential for brain development, has an important role in the brain myelination, and we know from some case reports of babies born to vegan mothers who were not supplementing during pregnancy and breastfeeding. These babies developed developmental delay and some neurological sequelae, and some of them died. So vitamin B12 is something that we have to take very seriously. And my recommendation is for a woman who was taking whatever strategy she was taking, to add a little more during pregnancy and breastfeeding. For example, if she was taking a multivitamin supplement, to add at least another weekly dose, high dose just to complement that. Also because we know that multivitamins, if they have vitamin C, the vitamin B12 in the same supplement is not so well absorbed. So I always recommend to add another supplement to take apart from the meals and apart from the multivitamin supplement. And if she's taking fortified foods, again, she needs is good to add another extra supplement. So vitamin D, the same as with folic acid, is the recommendation now. The recommendation, at least from the NHS, is that most people in this country, pregnant or not pregnant, vegan or not vegan, need a supplement because it's quite difficult to get enough from the sun. We don't spend much time outside, and unless you are a very, very clear skin, and unless you are spending a lot of time outside, it's very likely that you are not having enough and you are at least having suboptimal levels. So the general recommendation is to have this, and for high-risk women who are a lot, because I think most of us should be in one of these group, at least to have more. Some people think that these 400 units a day are probably not enough. The European Safety Agency, they recommend more, like 600, and some people in the US, they recommend 800 to 1,000. And the upper limit is 10,000 units per day, so there is there is a margin of safety. So it's good in some cases to have to take a little more. And if you are going to take a blood sample from this woman for something, it's useful to remember to measure the levels, because it's quite often to find deficiencies or suboptimal levels. And the last supplement, or the last thing, is omega-3 fatty acids, that they are very popular lately. Recently, there's still a lot of controversy about them, with some studies reporting, as I think you know, no effects on cardiovascular disease when supplements are used, or not in other chronic diseases. But I want just to focus on the effect on pregnancy and breastfeeding. This is a very simplified thing, but I think you know that we have three main ones. So this is the one that comes from plant foods, from walnuts and seeds specifically, but also from other ones. And from this one, our body can convert some of these into the long chain ones. And these long chain fatty acids, long chain omega-3, are thought to have beneficial effects. The problem is we don't know how much efficient this conversion rate is, and some people think it's quite low, it's between 5 and 10%. It's increased during pregnancy and breastfeeding because the fetus needs a lot of this, because again it's important for the brain. It is part of the fat in the brain. But we still don't know how much we can convert, and that is the reason why fish is recommended during pregnancy and breastfeeding and in general, because it's a source of this directly of this long chain. But what most people forget, and also including health professionals, is that fish don't really produce these long chain fatty acids. They take it from seaweeds. So we could also take them directly from the oil extracted from this food. So there is a vegan source of these long chain fatty acids. And after years and years of different studies, we have a few months ago this systematic review from the Cochrane collaboration, and they did a meta-analysis of 70 studies, including almost 10,000 women during their pregnancy and breastfeeding period, and they found high quality evidence, strong evidence, that supplementing with these long chain fatty acids during pregnancy could reduce the prevalence of preterm birth and also the low birth weight in their babies, which I think this is now strong enough. There is not so many data about other outcomes. So, for example, for the prolonged gestation or perinatal outcomes in the baby, like perinatal death or admission to the intensive care unit for the babies, there are some data that probably can be beneficial as well, but at least for these two things can be useful. And preterm birth is quite frequent and can have important consequences for the child life, and is affecting almost 5 to 10% of births, of total births. So this is an important point to take into account. Even if we don't have a clear, very strong evidence about the effects on the child development and health, there are some studies suggesting some beneficial effects, like better visual, better language, and better cognitive development, and also the reduction of some problems during childhood. So based on this, even if we don't have very strong evidence, I recommend women during pregnancy and breastfeeding to take a supplement of a vegan source of long-chain omega-3 fatty acids, because I think they can be beneficial in the long term. Okay, so based on this, we have been looking at in the last minutes, what is the best thing we can say to a vegan woman who is pregnant or during breastfeeding? So her diet should be like a plant-based diet for everyone. So this is the basic. Should be based on fruit and veggies, whole grains, and source of protein. This is like, and with this proportion, like more or less 1/4 of each food group. Among veggies, we should remind them to include on a daily basis those rich in calcium and those rich in vitamin A, because of the important role during pregnancy and lactation. Also, in the fruit group, it's important to remind them to include those rich in vitamin C, because of their role in improving iron absorption. So this is another important. And remember, in the protein-rich group, to include at least between 2 and 3 servings of legumes and beans, 2 in the first stages of pregnancy, but probably 3 when the baby is growing fastest, in the 3rd trimester, and also sometimes during breastfeeding when the baby is taking like a lot of milk. And also 1 to 2 the same servings of nuts and seeds. And remember that they don't only provide protein, but they provide very important minerals and B vitamins as well. So they are very good. So this is the basic diet for them. And then remember the supplements. This is a summary of the supplements we have been talking about that they should be taking. And also, of course, like the general advice, like avoid alcohol. There is no amount of alcohol that is safe during pregnancy, so the only recommended amount is 0. This is very important. Babies can develop what is called fetal alcohol syndrome, which can have really bad consequences for the rest of their lives, like mental retardation and other problems. So the amount is 0 always. Also avoid smoking because of the effects on the placenta growth and nutrition of the baby. And of course, not a lot, but daily exercise and being in good. So, okay, I don't know if we have questions now. No, they say no, but no, thank you. I just wanted to say that we'll have time for questions later, and I'll be here for the rest of the day, so at any moment you can speak with me. And if you want to write down my email address and write to me whenever you want, I will be very happy to hear from you. So now, thank you very much for your attention.